So good morning to all of you, and I'm going to speak about targets in cancer. It's not always present, but when it is present, then the survival can be improved greatly. Like to start with an example in CA breast cases. If there are estrogen and progesterone receptor, and if then the treatment is very simple. You can give them just oral pills, and that will prolong the lifespan of those breast cancer patients who have been operated. Given chemotherapy and radiation therapy, you just give them pills for good 5 years, and the survival will be improved. Now there is another target which is found in breast cancer. This is not found universally, but this is found say in 15 to 20% breast cancer patients. And if you target that target, which is called HER2/neu, again the survival is increased. So then the survival is relatively increased by approximately 50% compared to when you don't use that targeted therapy. Similarly, in lung cancer cases, if there is expression of a target called ALK, which is seen in 7% of non-squamous lung cancer, the median survival of stage 4 lung cancer in those cases can be done up to 3 years. That's a median survival, which means 50% of those patients are going to live longer than 3 years, and 50% are going to live lesser than 3 years. Similarly, there is another target which is called EGFR, which is expressed in approximately 25% of those cases. And when you do targeted therapy, then the median survival is close to 2 years. And the beautiful thing about any targeted therapy is that hardly they have got any side effect, because they just go and bind on the targets and leave the normal cells apart, and they don't damage it, unlike chemotherapy. So this is all about in small about targeted chemotherapy.